So we're here talking about our population health initiative, and really its overarching goal is to make Hancock County the healthiest county in the state of Indiana. And in order to do that, we realize that we have to interact with our patients and our communities and even our employees in different ways than we ever have in the past. As we move into the future, we as a healthcare organization will be held accountable for the health status of the people in the areas that we serve. So currently, we are paid just to treat people when they're sick or when they're injured. So they come in the door, we take care of them, we send them home, we send a bill, and that is our business model. But in the future, we will be treated more like a payer or like an insurance company, where we will be given a set amount per person per year, and if that person costs less during that year, then there is a margin in it for us, and if they cost more, then we would actually have a negative margin or a loss.
For our area of population health, we focus primarily on the community, so outside of hospital walls. And that for us means we did our community needs assessment in 2017, and not unlike many communities, we found 4 major areas of concern for our community.
So there are 4 fundamental spaces that we have to practice in and practice differently as we move into the future. The first of those is that we have to understand that 75% of all the money we spend in the American healthcare system is spent based on the chronic disease status of the people in our communities. And what we have learned from our parents and grandparents in the last century, and they faced communicable diseases, and they practiced prevention. So they figured out that if you could create a vaccine for polio, you could prevent polio. And they cleaned up our water, they cleaned up our food, they developed sanitation systems, so they prevented all of these communicable diseases, and in fact doubled how long we live as Americans in the process. So we're applying that same thinking, it's called public health thinking, to chronic diseases.
So we would hope to identify patients that are what we would call on the rising risk list, and we would hopefully help catch those individuals before they're at a chronic level and help turn their cycle around or their body around to where we don't get them into the chronic disease stage.
I see patients while they're in the acute care setting. I see them in the hospital on all the units, and I make sure that I keep their primary care physician in the loop of what's going on with them while they're in the hospital and set up their follow-up appointments. People that don't follow up with their primary care physicians, or if we don't help them make those appointments, a lot of times will not do that themselves, and they end up back in the hospital for the exact same reason. And that's what we're trying to prevent. You know, in the past, we always treated people reactively. We only treated you while you were sick for this reason, but now it's more of a preventative and proactive, where we want to treat you for your chronic illnesses ahead of time so that way you don't end up in the hospital.
I go out and check with the patients at their home to see how they're doing, if they're having any medical issues, if they're having any medications problems that they need addressed. Some may not have enough food for the month, some may not have money for their medications. Have some that just don't have transportation. So there's a lot of different issues. And I have a resource book that I can get with them and we can see what we can do to help them.
When we really think about the drivers of our health status, it has mostly to do with our behavior, and it's the choices that we make. And when you look at the choices that we make, they are highly correlated with the choices that we have. And we used to build our communities in a way that we would walk to different things. You'd walk to church, you'd walk to the store, walk to the library. Well, most of our cities now are built so that you can't walk, you have to drive everywhere. So we created a society for ourselves whereby the environment that we live in drives us into unhealthy choices. So the second part of our population health paradigm is about how do we make the healthy choice the easy choice.
Healthy 365 looks at what options are available in the community and how do we work with local partners, local businesses, and community leaders to help change the culture of wellness. Part of it's infrastructure, part of it's policy, part of it is practice. How do we address walkability, bikeability, trails, healthy dining locations in our community?
So the third pillar then is the understanding that we need to interact with people in more than just their physical natures. We realize that people are body, mind, and spirit. There are many organizations in our communities that are working in the space of mental health and substance abuse. The problem is that they have these very narrow slices that they're involved with. but never do they really all get together to create a true network or a true system of care. So we decided about 3 years ago that we needed to play a role and have someone whose whole job and their whole goal in life was to create that system of care.
We bring together agencies, schools, healthcare, churches, law enforcement, faith-based organizations. We bring all of these different entities together to work with each other to collaborate on those efforts. My role in system of care in general is to make sure that resources are readily accessible. I think the biggest achievement with it, if you ask any system of care partner, is the fact that they've never seen any kind of collaboration like this ever before.
You can just kind of see the light bulb go off that says, I've got a patient, or I've got a client, or I've got a family that needs that service, and I didn't even know about it.
So we have a congregational health network, and we are now partnered with more than 18 churches in Hancock County. The way it works is that if you show up in the ED, or if you show up as an inpatient, that our electronic medical record will flag you as being part of the congregational health network. Our navigator will go talk to that patient, and they'll say, hey, we see that you're part of the network. We wonder, would you like us to call your church? And so we call the church, and they say, sure, we can watch the dog. And, we'll put them on the prayer list, and we'll have food delivered to them when they get home as well. It's like an extra layer of love around those people.
So health is much more than just, do you eat vegetables and fruits, or do you run 5 miles a day? Your mental well-being and your spiritual well-being impact those choices that you make. But I think what's unique about the congregational network is we connect members back to their congregations, so that people they pray with every week, people they're with, their church family, can be with them in times of need. There's so many doctors and nurses that you see in and out of your room every day. Having someone who you know to be able to walk with you in your journey of health and wellness is critical.
We have to understand that a vast amount of money is spent in the last few years of our life. And it is spent usually because people have not thought in advance about what they're going to do if they're in the end stages of a disease process, or if they're in a critically ill situation themselves or their family. And we want to have people be intentional about that. So we have partnered with a company called Curadux to really begin to explore this space and see how we can come alongside families and individuals in that period of life. And we have that, we have our hospice program, we have a palliative care program. We put it all together, and that is the fourth leg of our population health stool.
I have sat with and held the hands of literally thousands of patients in the last days and hours of their lives. It's a privilege and an honor that I don't think I can fully express. People who are at the very end of life are brought to the emergency room, and they're admitted to a critical care unit, and they are scanned and treated and poked and prodded and scanned some more without anyone ever having a good conversation about what are the goals of this care? What are we trying to accomplish here? If we can find a way to increase the number of people who have had those conversations with their family members or with their physicians, I think we'll be able to better serve people at the end of life than we do right now. I'm really excited about getting Curadux to partner with us, because the conversation that I was just talking about, the very difficult conversation that chronically or terminally ill people are reluctant to have with their family members or with their physicians, is something that Curadux is going to do a great job of helping us have, so that people make very informed choices, which is really the goal. We don't want people not to have treatment. We don't want people to have futile treatment. We want them to have exactly the treatment that will be the most meaningful for them.
We're very lucky, we're very fortunate, because our leadership has seen this as a need. It's very hard to find other, especially community hospitals our size, that are trying to do this.
We have made some pretty fantastic progress. When we started this whole thing about 3 years ago, maybe almost 4 years ago now, we were 26th in the state of Indiana, according to the county health rankings. We're now 6th or 7th, and the U.S. News and World Report just came out with a new ranking that would show us to be 3rd. And in fact, we're in the top 5% of healthy counties in the country. So we're pretty happy with what has happened with that and the progress that we have made. What a blessing it is to work in a place where we love people for a living. It's actually coined by one of our hospice chaplains. That undergirds and is foundational to everything that we do. So when people see us, we want them to see that. And I hear stories from the community and from our own associates all the time that reinforce with me that that is exactly who we are and it's who we want to be.